Hi, Mr. Lineberry. My name's Amanda. I'm going to be your nurse today. Is it okay if I sit down a minute?
Sure, have a seat.
Okay. We're going to be doing a heart assessment today. We're going to start by getting your history of any heart problems you may have had in the past. We're going to go over your family history. And then I will also be doing a physical assessment of your heart where I listen. This will be recorded and publicly for public viewing. Is that okay?
Sure.
Okay. Let's start with your history. Have you ever had an irregular heartbeat?
No.
Heart attack?
No.
Ever been told you had high blood pressure?
No.
How about chest pain?
Yes.
Okay. How often do you have chest pain?
About once a week.
Okay. And describe that chest pain for me.
It's just a sharp pain in my chest. Like I say, it radiates out when it happens.
When you say radiate out, does it stay in the chest or does it go down an arm or?
No, it stays in the chest, but it feels like it's covering the chest.
Okay. Any associated shortness of breath?
Sometimes.
Do these episodes happen with activity or when you're under a lot of stress? Or
Sometimes.
Okay. Can you tell me a little bit more about when it starts and stops? Is there anything you notice that is constant with it?
No, once it comes on, I slow down a minute and relax and try to take a few breaths and allow it to calm down. And usually most of the time it subsides and I move on.
Okay, so it stops with rest.
You're right.
Okay. Have you ever had an EKG done?
Yes, I had an EKG and a stress test done a couple years ago.
And what did they find then?
Both came back normal.
And was this with the same symptoms or was something different going on?
Some stuff were different. I had a steady, sharp pain. It lasted. It was persistent, and shortness of breath that were both persistent for about a week solid.
Okay. Are you on any type of medication to help relieve this pain, or have you been to a doctor about it since then?
No.
Okay. I do suggest that you do go to a physician to get this checked out, because if you're having chest pain once a week, you just want to rule out that there isn't any other causes.
No.
How about, have you had your cholesterol and triglycerides checked recently?
No.
Okay. Do you have a primary care physician?
No, I do not.
Okay. Once we finish this assessment, I'll be happy to help you set you up with one if you would like.
Thank you.
Okay. When you sleep at night, do you find yourself using extra pillows, or does your position affect your breathing at all?
I use 2 pillows to keep me elevated.
Do you feel short of breath if you don't have 2 pillows?
Yes, I can.
Okay. Have you noticed any swelling?
No, I haven't had no swelling.
How about fatigue?
I do get fatigue easily.
Okay. And you said you weren't on any type of medication.
No, I'm not on any medication.
With this fatigue, is this something new that started as well, or is it when you're on the days that you have your chest pain and shortness of breath?
Yeah, some days it's worse than others. Usually, that comes along with the shortness of breath and the chest pain.
Okay. Let's talk about your personal habits. How's your diet?
I would classify that as poor.
Okay, why would you classify it as poor?
I eat a lot of junk food and fast food.
Okay, I can give you some pointers on your diet before you leave today. That may help alleviate some of your symptoms if you're up for that.
Sure.
Okay. Also, are you a smoker?
Not no more, but I used to.
Okay, how much did you used to smoke?
I was about a pack a day when I quit.
And how long ago did you quit?
It's been almost 8 8 years now.
Okay. How about drinking?
No, I'm not a regular drinker.
How would you classify your stress level?
High.
Do you have any, smoking obviously might have been a way that you dealt with stress before in the past. How do you cope with stress now?
Poorly.
Why do you say poorly?
Because I build up and get angry, and I'm sure that my blood pressure skyrockets due to it.
Is this associated, when your stress gets that high, is that when your chest pain and shortness of breath happens, or
It can sometimes.
sometimes but not all the time?
Not all the time, no.
Okay. One thing I forgot to ask you earlier, do you wake up in the night frequently having to use the bathroom, having to urinate?
No.
Okay. Family history. Do you know of anybody in your immediate family that's ever had a heart attack or any type of heart disease or blood pressure?
Not as I'm aware of.
Okay.
But I don't have much background on family history.
What do you mean?
I wasn't associated with my family growing up. I was part of the state. I grew up in group homes and stuff like that, so family history is not something I have a lot of knowledge on.
Okay. What questions do you have for me? Is there anything that I missed that I didn't ask?
No, just at the end of this, maybe give me some pointers on how to eat more healthier, and maybe some exercises that would help me build up stronger heart, be more cardio and stuff like that.
Okay. How was your exercise now?
Poor.
What kind of work do you do?
I'm in the heat and air industry.
So that keeps you pretty active there, doesn't it?
Yeah, it does. I have to do a lot of crawling and heavy lifting and stuff of that matter.
But not much cardiac, nothing that would really get your heart.
Right, nothing that's high-paced, fast motions. You know what I'm saying? Everything's pretty well a steady pace.
Okay. Let me wash my hands, and then I'm going to listen to your chest, okay?
Okay.
All right, Mr. Lineberry, if you would lay down for me.
This way or this way?
It don't matter. Okay. First, I'm going to do what's called palpitation. You're just going to feel my hand on your chest. I'm going to feel your heartbeat.
Okay.
Okay. Now I'm going to do a... When I'm listening, I'm gonna listen for, I'll be listening in spots for a while. That doesn't mean that necessarily that I find anything wrong. I just have to listen long enough to know that I'm not hearing anything wrong, okay?
Okay.
Yeah, you're gonna feel me listen in several spots. I'm listening for the opening and closing of your valves.
Okay. Do I need to take my shirt off or anything?
No. get you to straighten your head up, I am going to look at the veins at your carotid and jugular veins in your neck. I'm going to listen up here too. Okay, you can sit up.
Thank you.
Well, I heard normal heart sounds. You had what we call S1, S2 sounds, which is normal. I did not hear any murmurs. You had a regular rate, a rather regular rhythm, so all that sounded good. But my only concern is with your chest pain that you are having once a week. You really need to follow up with the physician on that, okay?
Okay.
I will get you some education on proper diet, but I can tell you, you want to make sure that you incorporate some fruits and vegetables in your diet. And starting off with exercise, you want to start off 30 minutes a day. If you start having chest pain or shortness of breath while you're doing that exercise, go ahead and stop, and you need to go see a physician. Okay?
Okay.
Do you have any questions for me today?
No, none that I can think of. Is there anything I should know about with the situation, about the fact that I do have them once a week? Should I wait until there's an issue, or should I just go ahead and start talking to a doctor about it?
Well, since it has been so long since you have been seen and you've been having these regular episodes of chest pain, I suggest going ahead and setting up an appointment. That way you can go ahead and get a full workup, because you said you haven't had any type of exam the last time was 2 years ago.
Right.
Yeah, and you need to go ahead and get that, find a primary care physician that can follow with your care. So that way, if there are any changes, that physician already knows where your baseline is, health is, and can better assist you that way.
Okay, and what kind of labs am I going to be looking at?
More than likely, they will check, they're definitely going to check cholesterol, see where your cholesterol levels are, especially since you say you don't eat very well right now. They'll also check, my guess would be, I can't tell you for sure, if they will want a basic metabolic panel, which checks your electrolytes, see where you are there, and then just a blood count to see where you are there. Just baseline labs to see where you stand already. If you noticed any sweating or any symptoms like that with your chest pain and shortness of breath?
I haven't noticed, but I really wasn't thinking of something. Should I be looking for something like that when those issues come up?
When you have those issues,